Good afternoon, everyone. My name is Tiffany Kaikamanu, Community Relations Manager. And on behalf of CalOptima Health, I'd like to welcome you to today's InfoSeries, Focus on Equity for a Healthy Orange County. Please note that today's event will be recorded, and by attending, you agree to be recorded. Now I have the pleasure of introducing Young Kim, who serves as CalOptima Health's Chief Operating Officer, who will kick off today's event. So please join me in welcoming Young to the virtual stage.
Thank you, Tiffany. Good afternoon, everyone, and welcome. I am so inspired to have all of you, all of us, come together like this to learn about health equity in our community in Orange County. The concept of health equity and the drive to do better for all of our communities, these are high on all of our minds right now. And it's been a cornerstone for CalOptima since day one, even when we didn't call it that. For nearly 30 years, CalOptima has been alongside many of you, serving Orange County's low-income, under-resourced residents, providing access to healthcare. And we've always strived for care that's at the same quality available to others in our community. 30 years in, and we've only just scratched the surface. The pandemic that we all just came through made health inequity very real, made health disparities very evident, with different vaccination, mortality rates based on our ethnicity, based on our communities. We know we have a lot to do. This past January, CalOptima Health embarked on a major statewide initiative that has health equity at its underlying goal. It's known as California Advancing and Innovating Medi-Cal, or CalAIM, and I hope you've all heard about it. CalAIM is trying to transform Medi-Cal by doing a better job of addressing the social determinants of health. The state has been calling this initiative a catalyst for equity and justice. Through CalAIM, CalOptima Health is now able to provide expanded benefits for housing, home and community-based services in a way that we have never been able to do before. And it's exciting to see what we can do for our members. In a separate effort, some of you may have heard, some of you are working with us on our major effort to promote enrollment in CalFresh. This is California's food assistance program known as SNAP, or food stamps. We've been in a major outreach and advertising campaign since April, and since then we've helped nearly 30,000 more members obtain money for reliable access to healthy food. We're just getting started at CalOptima Health. Earlier this year, our board approved our 3-year strategic plan, which will take us from 2023 to 25. And one of our critical focus areas is overcoming health disparities. We are working on all of our tactical priorities and activities to promote and reach this goal together. And I look forward to having more updates to share with all of you in the months to come, and to getting your feedback on what CalOptima could be doing. So thank you again. Welcome to this info series. We are featuring 3 outstanding leaders from our community, and I know that you will be inspired by their insights and their commitment to health equity for all of us. Thank you.
Thank you so much for welcoming our community stakeholders to today's info series. Please note that event materials are available for download in the chat box and will include the agenda, slide deck, and supporting materials. We'll also share these materials with you in a follow-up email in addition to the event's recording. Now, given that we do have a large audience and to minimize interruptions, everyone's microphones have been disabled. Attendees also have the option of turning on closed captioning to support accessibility. You have the opportunity to type questions in the Q&A box, which is located on the control panel at the bottom of your screen. And in lieu of having a Q&A session at the end of the event, questions will be facilitated during the presentations. Now it is my pleasure to introduce our esteemed panel of presenters. Hugh Nguyen currently serves as Orange County Healthcare Agency's Director of the Office of Population and Equity. The office aims to increase healthcare agencies' impact and actions related to addressing health disparities and advancing health equity. Hugh previously served as the Director of Systems of Care at Mind OC. Hugh is also a community organizer and advocates on a variety of social causes that impact marginalized communities. He co-founded and served as executive board chair for Viet Rainbow of Orange County, the only 501c3 Vietnamese American LGBTQ organization in the United States. Hugh holds a Master's of Social Work degree from California State University, Long Beach, Master's of Business Administration from Brandman University, a Chapman University system, and a Bachelor of Arts in Psychology from University of California, Irvine. Katie Balderas is CalOptima's Health's Director of Population Health Management. She joined the team in 2021, bringing more than 15 years of experience advancing health equity in nonprofit organizations and local health departments. She previously served as the inaugural equity officer for the City of Long Beach, and in that role, established the first municipal office of equity in Southern California, focused on advancing racial equity and reducing health and social disparities. Prior to that, Katie worked for LA County Department of Public Health on tobacco control, maternal and child health, and housing policy as a social determinant of health. She graduated from Long Beach State with her bachelor's degree in psychology and master's in public health. Welcome, Katie. And finally, we have Mario Ortega, who is the Chief Executive Officer of Abrazar. He has held this position for 3 years and served as Abrazar's Chief Operating Officer for 15 years prior to this. He received a Bachelor's of Science in Business Administration with an emphasis in Finance and Accounting for the University of California, Berkeley. Before joining Abrazar, he was a lead nonprofit audit manager for a CPA public auditing firm. Mr. Ortega was an audit manager leading financial, program, operational, and grant compliance audits. He also assisted with business consulting projects with his nonprofit clients. Please join me in welcoming our esteemed presenters to the virtual stage, and now I'll turn the time over to Hugh Nguyen. Next slide.
Okay, next slide. I think this is still Katie.
Great. Yeah. Thank you, Hugh. Thank you, Tiffany, for the introduction and the warm welcome. So before we dive into today's session, we wanted to start with a land and labor acknowledgement. We offer this to show respect for the Indigenous people as the traditional stewards of this land we know as Orange County. We honor the Hashimen and Tongva peoples as the original and current caretakers of this land and extend our gratitude to all of their ancestors and descendants, past, present, and future. We also acknowledge that much of what we know as this country and our community today, our culture, our economic growth, our development throughout history has been made possible by the labor of enslaved Africans and their descendants, as well as the voluntary and involuntary labor of immigrants and Indigenous people who have contributed to building this country and continue to serve our communities every day. So as we acknowledge this labor and sacrifice, much of what Hugh and Mario and I will discuss today in this session is the resulting impact of oppressive forces such as racism that are still felt today in many health inequities our communities face. And so in naming these deeply rooted inequities, we also recommit to our shared responsibility for combating these systems in our daily work and creating systems in which everyone, no matter who you are, is healthy, safe, and treated with the dignity that all people deserve. So next slide, please.
Thank you, Katie, for grounding us in the land acknowledgement and really help frame the conversations that we're hoping to have today and moving forward. Appreciate that, Katie. For those of you who don't know me, I'm Hugh Nguyen, and I work for the Orange County Health Agency as their first director of Population Health and Equity, which is a new office that was launched in December of 2020, so almost 2 years now. And I've had the great pleasure of working with many of you on the call today, on this webinar today. And so I'm really glad to see you virtually again. And with that, I'll kind of move on with my presentation. Next slide. So many of you know the Orange County Health Agency, but may not know that we kind of revamped our vision, our mission, and our goals. Right smack in the middle of the pandemic, our fearless leader, Dr. Clayton Chow, had us rethink our vision, mission, and goals. And so we went through a strategic planning process in response to the pandemic, as well as the social justice movement that was happening in the wake of George Floyd's murder in 2020. And so our new mission, vision, and goal is really centering around promoting population health and equity in partnership with our community. Next slide. And so before we kind of continue with the conversation today, really wanted to lay the foundation in terms of our shared understanding of what we mean by equity, equality, and justice. We couldn't use the slide, the graphic that I really liked that illustrated all three. So we took this from the Robert Wood Johnson Foundation, which really illustrate the difference between equality and equity. And we can't really use the chat function, how else this would be a little bit more interactive. But equality, as you can see, has the assumption that everyone benefits from the same supports. In this illustration is the bikes, regardless of what their needs are. All right, so that's the equality, sameness in terms of supports and resources given to all population, regardless of needs. Equity really looks at the fact that everybody gets the supports and resources that they need in order for them to achieve optimal health, right? Which produces equity. So, and so as you can see in the illustration, depending on the person's needs, they're getting the bicycle that would benefit them, right? So that's equality and equity. You don't see a justice kind of framework here, but really when it comes to justice, we're looking at removing all the systemic barriers and the root causes of why inequity exists, right? That includes removing racism, removing oppressive practices, laws, etc. So when we're able to remove that, then we're able to achieve health equity. So that's the justice piece, the removal of those root causes for us. Next slide. And so what do we mean by health equity? And so this is a long definition also from the Robert Wood Johnson Foundation. And I know that this definition is what we're using at the health agency, and also very closely aligned with CalOptima, and also what Mario will be speaking about later. But health equity means that everybody has a fair and just opportunity to be as healthy as possible, right? And in order to do that, there has to be a removal of obstacles to health and also the consequences of those obstacles. So what are some of those obstacles to health? That includes poverty, discrimination, deep power imbalances, right? And then what are the consequences of those obstacles? The consequences are lack of access to good jobs with fair pay, quality education and housing, safe environments, and I would say quality healthcare, not just healthcare, but quality healthcare. So the consequences, the lack of access to good jobs and fair pay, quality education, housing, safe environment, healthcare, and quality healthcare, those are what we call social determinants of health, as many of you may have heard that. Next slide. And so this is, for us, really good illustration of what social determinants of health is. Again, social determinants of health are life-enhancing resources, such as food, housing, economic and social relationship, transportation, education, and healthcare. and the distribution of these life-enhancing resources across populations, right? That effectively determines the length and quality of life. On the right hand, you see some of the 5 sort of core groupings of social determinants of health that is put out by the Healthy People 2020, and also the CDC used this framework as well. Next slide. A little bit more detail. So healthcare, so access to care, quality of care, only resulted 20% impact like 20% of health and health outcomes of an individual. The other 80% is actually the social determinants of health, right? So what we do see is that social inequities, whether that's socioeconomic factors, physical environment, health behaviors, are actually the root causes of health inequity. And that kind of illustrate here for you with this person. 20% of the person is represented by the healthcare, access to care, quality of care, and the other 80% are the social determinants of health. Next slide. So what are we doing as a county in Orange County around health equity? And for us from the Healthcare Agency, in partnership with CalOptima, in partnership with Mario, and all of you here today, we launched from the CDC grant, launched an Equity and OC initiative, which is an initiative to create a healthier, more resilient, and equitable Orange County. That is our aim, that is our goal, that is our mission and vision in the next 2 years for the grant and beyond. Next slide. And so very high level, this was a national initiative. This grant was a national initiative from the CDC to address COVID-19 health disparities. These are the 4 strategies that they want all of the grantees to focus on. One is expanding existing and or develop new mitigation and prevention resources, specifically around COVID. The other one is data capacity and infrastructure. Third is building the capacity of local health department, and Orange County Health Agency is considered a local health department around health equity. And then the 4th strategy, and the most important strategy, is around mobilizing partners and collaborators to advance health equity and address social determinants of health. So when the CDC say that they would be flexible with how we use the money, we took that and really ran with it and really try to be innovative around how do we approach these 4 strategies, right? And so that birthed the Equity and OC initiative in, God, it felt like 20 years ago, but it was actually only February of this year. Next slide. Okay, so I want to spend some time in terms of letting you know what we've done so far, where we're headed, and then I'll pass it on to Katie to learn more about CalOptima. For the Equity and OC initiative, there are 3 phases. The first phase is the social determinants of health prioritization phase. Next slide. So this is what we've done so far since February. We convene our partners, collaborators, community members, and form an Equity and OC task force in February of 2020. Within 4 months, the community, that task force, based on data and based on lived experiences and expertise of folks, prioritized 3 social determinants of health areas. The 3 social determinants of health areas are food as medicine, housing as health, and health and healing, which is a catch-all category, really being responsive of the mental health impacts of COVID-19 and the need for community to heal from the trauma of everything that's been happening with the country in the last, the county in the last three so years. And then by June 2022, we formed different population health equity collectives and started forming community health improvement teams to work on improvement projects related to the 3 social determinants of health. In June, we also launched a Community Health Improvement Leadership Academy. The academy is meant to build relationships make connections with community, but also build skills and capacity in the community to do this work as a community. And so there was a lot of skill building and relationship building activities in the Chila. And then in October, we began the action and learning community with, I think, over 20 equity improvement teams working on projects to address the 3 social determinants of health. Next slide. So that's what we've accomplished so far. And we'll play a video to encapsulate what Equity in OC initiative is for folks, and then we'll continue.
Did you know there are neighborhoods in Orange County where the average life expectancy is 14 years less than other parts of the county? Or that people living in certain zip codes were 61% more likely to die from COVID-19? What determines these differences in our health, or how long we're expected to live? Truth is, your zip code matters more than your genetic code when predicting how long you'll live. Factors such as your education level, job status, and where you live and work have as much or more of an effect on your health and well-being as your age, sex, family history, behaviors, or medical care. These factors are called the social determinants of health. Many of the health disparities in Orange County can be traced back to inequities stemming from these social determinants of health. Picture a world where people living north of the Y aren't 1.7 times more likely to develop asthma than residents to the south. Or a world where one person wouldn't be 19 times less likely to attend college than someone just a mile down the road. To create that world, we need to not simply make everyone aware of these inequities, but work together to eliminate them so everyone can reach their full potential. The Equity in OC initiative has created an action and learning community, a diverse group of passionate people, all with unique lived experiences, coming together to tackle these problems. This community will build relationships, pool skills, and develop action plans to address inequities in Orange County. Funding and grants will be available to teams within the action and learning community to put their action plans into practice. We believe health isn't just a right, it's a shared value, because improving the health of the entire community takes, well, the entire community. Your involvement in Equity in OC initiative will help create a healthier, more resilient, and equitable Orange County. Want to take part? Lend your skills to our action and learning community. Join an Equity in OC task force meeting open to the public, or learn more about our mission at equityinoc.com.
Thank you. So as you can see, in terms of the action and learning community, and the word action was placed first intentionally, right? We wanted to make sure that the short period of time that we have for this grant, we're not just sitting around, and Michael Hunn always say this, just to admire the problems, right? But really just to take action and to do something about addressing those problems. And so action and learning was very intentional in terms of why we call it that. Next slide. Next slide. Okay, and so in phase 2, we're in phase 2, the action and learning community. And I'll tell you very briefly, because I think I'm running out of time. Next slide. So where we're headed together as an initiative, Orange County will make progress on our health equity goals through the action and learning community. The action and learning community consists of equity improvement teams, both community teams, but also at the health agency. We all have equity improvement teams that are working on different equity improvement projects, focusing on the 3 social determinants of health. And improvement teams will attend the Chilas and take action during the action periods. And the learning piece is during the action periods, whatever works or doesn't work, we're going to go through an iterative process and engage in a PDSA cycle to make changes to our approach. All right, next slide. And this is where we're at. The next Chila will be in May 2023. So please keep an eye out for that. An announcement will be made in terms of the dates in January of when the next Chila would be in May. So we're booking that right now. It is quite a fun event. You'll see my 5 outfit changes as I host the Chila. I'll make sure if you come, I'll do 6 outfit changes at the May Chila. Mario's laughing and Katie's laughing, but so at the whole community, we have been very committed to not just building capacity with the folks that are within equity and OC, but capacity in our community. And so the Chila has been quite open to everybody to attend. And then they go into an action period after the Chila. And can you forward the slide? Yep. We're going to sustain our goals in population health and equity in Orange County with this framework that we're putting out through Equity and OC. Next slide. We won't have time for this. I'll share this video out, but to get an essence of what a Chila is, I wanted to show this video, but we won't have time. It is not a conference. There's a lot of laughter, a lot of joy, a lot of learning, and a lot of community building in this Chila event for Equity and OC. Next slide. And that's it. Here's my contact info. You can directly email me with any question or call me with questions. I typically don't return phone calls, so it's better to email me than to call me. But that's my email. And thank you for your time. I'm going to pass it on to Katie.
Great. Thank you so much, Hugh. I really appreciate all of the great work you're doing for the healthcare agency and the broader Orange County community. It's really impressive, and it's also a really tough act to follow. I would say that we are so inspired at CalOptima Health by the work that you lead, and we're really learning a lot and are so grateful to be participating in it. So thank you. Hi, everybody. Again, my name is Katie Balderas. I'm the Director of Population Health Management here for CalOptima Health, and I'm excited to share kind of where we're getting started with our health equity journey. Next slide, please. So in the beginning of this year, January 2022, I formed a little work group made up of primarily CalOptima staff, just to get together and really start to take this question on. What does health equity mean to us as an organization? How do we operationalize this work? And so we co-created a definition of health equity, a vision for health equity, based on a few different resources, and you'll see that it's very similar to the definition that Hugh shared, but we define health equity as when everyone has the power to and ability to access resources to be as healthy as possible, no matter who they are or where they come from. We know and acknowledge that this is not something that a person or individual can do for themselves alone, and it really requires a commitment from everybody, just like Hugh shared. It requires commitment from community, healthcare organizations, governments, and others to remove obstacles to health. And those obstacles include poverty, discrimination, powerlessness, lack of access to all the social determinants of health that Hugh mentioned, good jobs, education, adequate housing, and safe environments, and quality healthcare, of course. So we're excited to kind of wrap our brains around what it is that we're envisioning, and then we got to work. Next slide. We looked at other frameworks from Institutes for Healthcare Improvement, a key partner in the Equity and OC initiative. We looked at Robert Wood Johnson Foundation and so many others to really understand what does it look like for us to organize this work in a way that makes sense. And so we developed this framework, and it really starts with organizational commitment, making an explicit commitment to advancing health equity to both internal, external stakeholders. And we've done this already through our new mission, our vision, our strategic plan, and our commitment to addressing health disparities through the investments and programs that we make, not just for our members, but for the community, because we know that supports the health outcomes in which our members live. Following that, we want to make sure we're using data and narrative to describe inequities, to really understand them, and also understand what the root causes are, because we know that individuals live in the context of families and in physical and social environments they live in. So understanding those root causes is incredibly important, and showing the narrative and how that connects to the outcomes that we seek is something that's really important to this work that we do. Next is really the action piece, the designing and implementing strategies to transform practices, policies, and systems. There's no one program or service that's going to get us to health equity. It's planting a lot of seeds and nurturing them to grow across all sectors of our community. We also recognize that health equity isn't just something that's targeted for our members, but it's also really targeted at our organizational level, not just within CalOptima Health, but within our providers, our health networks, as well as at the community level. And then, as Hugh has demonstrated with the equity in OC, it's really about ongoing learning and commitment to keep tracking our progress, continuously improving, and really being honest about our successes as well as our failures, and continuing to move forward in spite of everything we face. Next slide. So some of our current efforts, I would be remiss if I said this was an exhaustive list. It definitely is not. But see, these are some highlights of our current efforts here at CalOptima Health. Our current vision is to have an annual social determinant of health assessment for our members on an annual basis. And so we've got a lot of movement to explore what that might look like and how we might not only ask the right questions to know what our members need, but also put the right resources in place to make sure that we can connect them to the supports that they need. As Young Kyung mentioned, our strategic plan has a core focus on health disparities. And so we're in the process of developing operational plans that will get at that and really get us all to work and moving in the same direction. As I mentioned at the beginning, I formed an internal health equity and social determinants of health work group, and we developed that vision and that framework that I just shared. And we've also formed some action teams to really take a deeper dive into some of the bigger questions and issues around opportunities that we found. So one of those was really looking at the utilization of social determinant of health Z codes. And for those of you who are not in the healthcare industry, Z codes are what doctors use to be able to track a diagnosis of a patient. And now healthcare agencies have provided Z codes that provide documentation for somebody's housing needs or food insecurity needs. And so this allows us to be able to know what our members need, not just in terms of their clinical healthcare needs, but also their social needs. And so we wanted to better understand how are those being utilized, who's using them, and we know we have a lot of room for improvement in this area. We've also wanted to really focus on internally building our own staff capacity and awareness of what is health equity and what is the role that everybody in the organization plays in advancing health equity. And so that's another action team that we've formed. And we're still a lot of work in progress. And my next meeting immediately after this is our work group meeting. So I'm excited to be able to help co-lead that process. It's a great group. We also have a lot of programs and services that are really focused at supporting the most marginalized community members. An example is our homeless health initiatives, our street medicine pilot. The CalFresh enrollment initiative is really focused on increasing food security. CalAIM Community Supports is also really addressing the root causes of poor health, which we know start at the social determinant of health level. And CalAIM Community Supports is one of those resources. I would also, again, be remiss if I didn't name the great work happening in my own department, population health management. We offer health coaching, health education in multiple languages with many of our fantastic staff. We do mobile mammography, back to school events for kids, and a lot of great work. So I'm super thrilled to be able to lead our team as one of the key drivers of health equity work at CalOptima Health. So shout out team. Next slide. So in terms of next steps, we've definitely wanted to be more involved in the Equity and OC initiative. So Tiffany, my colleague here from Community Relations, we're exploring what it will take to form an equity improvement team focused on food security, really building off of the great CalFresh work her team has been leading. We have our board approved a Chief Health Equity Officer to be hired in 2023, and our leadership has taken a really thoughtful approach to that, and I'm excited for that person to come on and help steer this work. We've also we'll be undertaking a social determinant of health benchmarking assessment. And this is a way for us as a managed care plan to understand what are we currently doing and what are the opportunities that we should be doing to better understand the social needs of our members and how does that stack up against other managed care plans in the same industry. So that will give us a good kind of pulse on where we are and where our biggest opportunities are. And hopefully, I think we're heading in the right direction, but this will be a helpful tool to help us reflect on that. As I mentioned, doing annual SDOH member assessments and also closed loop referrals is another key priority. This comes through the Department of Healthcare Services Population Health Management Strategy, really making sure that not only are we asking what our members need from the social environment, but also making sure we connect them with the right resources and close that loop. And then finally, we are also going to be going after health equity accreditation by the National Committee for Quality Assurance. And this is a kind of a gold star of health equity, and making sure that we do it in a way that's really true to being informed by community and bringing up a lot of the values that Hugh has led his initiative with. I think will be something we're excited to pursue in the future. Next slide. So that is it for me. I'm so glad I was able to be sandwiched in between Hugh and Mario. Their work is so impressive. So I'm excited to hand it off to him to talk about vaccination equity and how that relates to health. Thanks.
Wow, well, thank you, Katie, and thank you, Hugh. And I think I want to just pause for a second and realize, for everyone to realize, we just had the Orange County Healthcare Agency present and CalOptima Health present about equity for a healthy Orange County. Think about before the pandemic, and now having a community-based partner as part of it. Did that exist 3-4 years ago? It didn't. And so I think we have to acknowledge that. There's been so much progress. We as an agency, Outside has never worked so closely with the healthcare agency and the CalOptima Health and other organizations too. So I think as bad as the pandemic has been, it has also created a shift. And this is, I think, shows part of that shift that's happened. So with that, let me get started with equity in action. I heard this last week, and I thought it was a great term that was used. And it really is we've been talking so much about equity, but what does it mean, boots on the ground, nonprofits that are doing the work with the community? So I'm going to focus just on the vaccination equity and how we got started with that, the partners we work with, and now how we're moving towards health equity. So let's get next slide. So for those of you that don't know Abrazad means to embrace. If you look underneath our logo, it has embrace, educate, empower. That really is what Abrazad is about. I want to read our mission statement because it's important for people to know that Abrazad is more than, although transportation is a great program that we do, and it is really critical and it addresses equity. It's not everything we do. We do so much. So Abrazad, we're dedicated to embracing the diversity of seniors and families in our community, educating them on the resources that we provide through our community collaborations, and empowering them to improve the quality of their life. We are committed to improving the health equity of our community. Next slide. And also for those that don't know, Abrazad, we've been around, we're going on 48 years. So I've been privileged to be the CEO for 3 years. I've been with Abrazad going on 19 years, but it existed way before me because there are some trailblazers way back when they were looking at the resources that the community needed. And a lot of the services that were provided back then, specifically with the public programs, there was no access to language or how to fill out, how to apply for benefits. And so that's actually how Abrazad was formed. So we're going now on 48 years. And so also, I just want to, for all the CBOs and all the partners that we work with, although everyone uses social determinants of health, and it's good to define it. But if you think about it, it's really the reason why Abrazad and all of your agencies exist, why we exist. Because there's been inequities, specifically around the social determinants of health, it's a reason why there's a need for us. And I think, so now we are addressing that and addressing how do we change these inequities that we know have existed for as long as Abrazad's been around and before. Oh, next slide. These are our key values of Abrazad. I'm not going to read all through them, but the slide will be available for everyone. And I do want to have times for Q&A, so go ahead and go to the next slide. So one of the things I'm going to talk about is one of the departments that we did form specifically out of the vaccination equity work that we're doing is our community health equity navigators. Some people call their internal health equity navigators. They will refer to them as case managers. Also in the community, we have our promotoras de salud. But what we decided is we created a department because we needed to connect all of our different programs together. Al-Rasad has over 25 different programs. And internally, some of our team actually would not know what the other departments did because sometimes it's so spread out. But also there's a need to connect with all of our partners and our collaborations that we have with different collaborators we're a part of. And so through the vaccine work that we did, we created this department. And really what they're focused on is looking at how do we improve the health access. And when I say health access, I mean social determinants of health. And how do they improve the equity for the community that we serve? I want to highlight that with the partners, we've had amazing partners that we've worked with through this, and I want to acknowledge their work because it's important to acknowledge them. So the Asian American Senior Citizen Service Center, AASCSC, you all will get to know them if you don't know them already. Hope Community Services, OCTAC, which is Orange County Children's Therapeutic Arts Center. We have Santa Ana Building Health and Communities, Madison Park Neighborhood Association Green. We have Oakview Comunidad, and we have the Kennedy Commission and other partners that are growing too. But through the work that we did with the vaccine equity, we have now hosted over 250 mobile vaccinations, vaccinated over 50,000 Orange County residents. And this is in the priority health equity zip codes. That is, I just want to make sure that that's pointed out or highlighted, because that really, I think, has saved the most vulnerable folks in the community. And it was through those efforts that we all did together that we were able to be effective and do the mobile vaccinations. So next slide. These are some of the work that our community health equity navigators are doing, but really is connecting resources. And we will, their contact information, they look to partner with other organizations and programs that are out there. They're constantly looking to see if there's something that we can connect our community to. If it's something that we don't offer or our partners don't, they will seek out. So please reach out to them. You'll see them all over. They've been attending a ton of fairs. They were at the Chila. They presented there. Their Catrina Dia de los Muertos giveaways were a hit. But please visit them, invite them. They would love to come over to your organization and partner with us. And at the end, I will share, we have an event this Friday that they actually have put on for our older adults that we will have. It's called Thanks for Being a Friend. It is a reference to Golden Girls theme, but it is an older adults program, older adults event, and a vaccination clinic that we will have at our Midway City this Friday. So you're all welcome, but we'll share that flyer later on. Okay, next slide. So vaccine equity, how do we go? What we want to do is, as Hugh mentioned in his slide, is we want this health equity moment to lead to a movement. So how do we do that? We've talked about this a little bit. And in reference to vaccine equity, we have to change the system. We have to ensure that there's access to vaccinations for the community. We have to build relationships, and they have to be centered on equity. We have to be willing to share power with our partners. We have to also advocate for resources. And sometimes that means it's a conversation where you don't agree on current policy, or you have to bring up that the current system is not working. And what I will say is that when we first started the vaccination work, our seniors in our community was telling us that they did not have access. They could not schedule an appointment. They could not use the app, or they didn't understand. It was initially only in English. So we jumped in and we said, hey, we need to be able to help our community. If we're talking about the most vulnerable and those that are at risk of dying or being hospitalized, then we have to have access. So first we knocked on the door and said, "Give us access," and then we kind of like we're a little bit more forceful and had to kind of kick the door open. But what I'll say about that is that never before was the reception so warm and welcoming and saying, "Yes, we agree. We see that issue. We want you to help us solve it. What can you do?" So we jumped in. So that's what we did. And the healthcare agency was so open to listening to our ideas. And now we're 250 mobile vaccinations and 2 to 4 every week still going on. We're still doing them with our partners. And like I said, it's over 50,000 vaccinations. I think on this one, it's okay for our partners to say, pat themselves on the back and say, good job. Also, we use data. It's been important in driving where we're doing our vaccination clinics. We pull data vaccination rates by zip code every week. We plan and look at where is there a need for us to continue to do the clinics. So you'll see some of the pictures we pretty much have been everywhere. The picture that's showing right there is one of the first mobile clinics. It was at the Asian American Senior Citizen Service Center. And they actually also asked us to bring the seniors to their location. And so this is one of the first ones 2 years ago. It'll be this January will be 2 years ago that we had this mobile clinic. Next slide. Okay, I realized that I did do my stopwatch and I realized I'm already over time. So what I'm going to do is I'm going to go very quickly through these. But this is highlighting some of the collaborative strategies that we've used. The slide will be available, so I'm not going to go through all of it. But really, the heart of it is that we will work with everyone. If there is a partner that is willing to work with us and to share resources and to collaborate, and it's going to be effective in reaching the community, we will do this pretty much anywhere. And that picture that we have up there, that just kind of shows that. It's 4 different organizations. We're at El Centro Cultural de Mexico. They were having an event, and we did it in the parking lot. And we were able to start vaccinations there. That we had several over there over the last couple of years. Next slide. Also on this one, we're going to have to keep on going further because we're running out of time. But this is just that we collaborate, we partner, and we also are looking at how do we sustain this. So how do we do it with bringing in new partners that are willing to do vaccinations in the hardest hit community members? We are willing to work with everybody, and we continue to do that. So we've also expanded who we're working with, and we'll continue to do that. Next slide. Again, too much here to go on. We got to move on. But again, it is about using data, identifying and addressing barriers that we see. And also really important is that we have to be flexible. I, as a recovering auditor, I do like things lined up. I do like things I love my Excel spreadsheets, but it's better to be, and we've learned, especially with the vaccine, is progress is better than trying to achieve perfection. And it's okay to learn, and it's okay to realize that your model may not be need some tweak, and you may need to adjust it, and that's okay to do that. Next slide. This is just an idea of some of the places we've done vaccinations. This is the Tortilleria in Northgate, and AASCSC continues to do that. And continues to do 2 a week there. We've helped with them a few times, but they're still there. This is another one is Goodwill. So you name it, senior apartments. We've been at schools. Every week we're at a different school center, shopping centers, senior centers, resource centers. You name it, we've been there. And we'll continue to do that. And if you have a need, reach out to us. We'll be able to schedule something with you. Next slide. These are some of our partners that I already acknowledged, but I did want to highlight that they've been in it and they've been just really doing the work, and they continue to do the work. And so kudos to you guys. Next slide. And then these are just some of the places we've been. This is CalOptima, where we had over 1,000 vaccinated. You can see the sweat on my forehead in the picture there, but it was a whole team there showing up, and it was a great event. All the partners there, but over 1,000 vaccinations at the event. Next slide. This is at the El Mercadito at El Centro Cultural. Because like I said, we go everywhere. And this is a great event. And we were able to start vaccines at their location also. Next slide. And just some of the other places that we've been to. Also about being innovative. When there was a super pods that were set up that people said, hey, these may not be the best access for older adults and those that are disabled. We said, well, let's meet. We met with the fire authority and HCA and set up special lanes so that we were able to go through the special lanes, get people vaccinated in their car that could not walk. And we did thousands through those where we actually timed and went on right along. 48 minutes from an older adult in a wheelchair from their home, pick them up through the clinic, special lane, vaccinated, and back home in 48 minutes. So you look at those barriers and then you solve them. And next slide, I think that's it. My contact information, reach out, like I said, and we love to partner with everyone. And back to Katie.
Wow. I am so impressed. I don't actually think I got a chance to see your full run through of your slides, and I am just so in awe. The vaccine equity work I was a part of at a previous job, and it's hard. And you have done this with such amazing creativity, with such strong collaboration. Like, kudos to you guys. That's really amazing. And also shout out to the healthcare agency for being so responsive and listening. It's not always typical that you see a government agency being quite so responsive. And I think that there's a lot to be said for government also being, a good listener and being responsive as well. Very cool. So the way that we had envisioned today was really just a conversation. We've got two kind of leaders in health equity in Orange County here, and so we have some questions. But before we dive in, we did have a couple questions from our participants here today, and some shout outs. So we have someone giving shout out to Mario and the Abrazar team for being so visible and active throughout Orange County. Way to go. So again, kudos to you. Thank you. Mario, while we're talking about Abrazar, somebody asked if you all serve Korean population as well. Do you mind answering that real quick?
Yes, we will serve all populations, and it's not a large population that has sought out our services, but we do have some partners. Like one, I will give a shout out to the Good Hands Foundation. They do amazing work. They are the leaders in tax preparation that we're a collaborative part of. And so if there's any, the primary clients the community that we serve primarily is Latino and Vietnamese because of where we're located. One of our centers is in the start of Little Saigon and on Bolsa and between Newland and Magnolia. So a third of our clientele is from the Vietnamese community. About 40% is from the Latino community, and then the rest is mixed. And so if we don't have someone internally that is bilingual, we definitely will have a partner that we can work with. And what happens a lot with our work is when you work with families too, sometimes you can work with the family to provide services to the community member. And that can also be an avenue for assisting.
Awesome. Thank you. So something that we'll get started with our first question. We had another question, but I'm actually going to save it for our call to action because it's a good one for how we might wrap up today. But for those of you who are joining us as our guest today, please feel free to continue to drop in the questions in the Q&A or in the chat, and we will answer them as we get them. A framework that's been helpful for me in this work is really thinking about your person, who you are, where you come from, your role, and then how that contributes to the greater system. But I'm curious about you as people, as my colleagues, who you are, how you got into this work, and just kind of what your personal drive is for this. Because equity is not easy, and you can't necessarily do it just as a 9-to-5 job and then go home and take your equity hat off and be done with it.
And I think, Katie, we're trying to make this conversational, right?
Yes,
So
absolutely.
I also want to hear the answer from you as well, right?
Okay.
Mara, you want to go first?
Sure. Some of those of you that you probably heard me talk before, but some of the that know me, but I got into this work because of my family. I'm the youngest of 9 children. And so we're an immigrant family. 5 of my sisters were born in Mexico. My parents were born in Mexico, and they came over here. My dad worked over here in the fields, and he worked at Huntington Beach, Orange County. We used to have tons of fields, and so he came over here to work to support his family, and then brought over my sisters and my mom came over. So we were a group of 9 children, immigrant family, living in Huntington Beach, one of the only Latino families in Huntington Beach way back then. And eventually, my aunt said, "Hey, you guys need to. We love you, but you need to move out. There's 11 of you now." And so, just thinking about social determinants of health, no one would rent to an immigrant family of 11. It just everywhere, every apartment said no, and that we're not going to do it. So I have some amazing sisters. We have 6 girls in a row, and then the 3 boys. And the sisters are just our leaders. They're trailblazers. And the oldest sisters all said, "Look, we have to buy." And granted, we're talking about these are teenagers, and they're like, "We will work after school, and we will help to support a mortgage, but we have to buy a home. That's the only way we're going to get our own home." So with that, well, that's where we ended up having a home in Huntington Beach. And so you can imagine, I mean, we were a family of 11, and we were definitely poor of the poor. And you know, we think about all the social terms of health. We didn't have healthcare. When we did, I got emergency Medi-Cal when I was a kid. So all the programs, all the things that we're affected by, like our family lived it. But what it did is that it did build resilience for us. And it made me want to, although I did go into business, and that's a totally different field, it wasn't what my passion was. But I was able to bring that training and then bring it to what my passion is. And I want to make a difference to the community. And that's how I landed. And it's interesting when I look at social determinants of health and how my family turned out. A lot of it happened to be is that because we could not get an apartment anywhere else, because my sisters worked after school to get that home, we had got to get a good education. We were also in the environment we're in. We were able to look at our friends and say, "Hey, we can. If they can do it, we can do it." So even though everyone's telling us that we couldn't, we're like, if they can do it, we're going to do it, and we're going to be able to do that. Now, what I do say is that it shouldn't have to be that way where every family should have to go through that and be resilient and be, bootstraps of. That's not the way the system should work. So that's part of why my passion of the work is to change that and to be a part of that.
I think when we first met and you first shared this story with me, first of all, thank you for sharing your story. I think it's so powerful to hear kind of where you come from. But, the whole narrative of like beating the odds versus changing the odds, like it sounds like your family is one that did beat insurmountable odds. And now you're working to change the odds for everyone so they don't have to work quite as hard to overcome the same challenges and barriers your family did. So thank you for that.
Yeah,
And
thank
what
you.
about you? What about you, Hugh?
Yeah, I mean, first of all, I did not know that story of Mario. There's so much alignment. I have also 11 people in my family. And so Mario and I we over the last 2 years, have worked a lot in the COVID equity work, right? And equity in OC, and yet have not heard that story. Um, so a lot of alignment parallel in terms of experiences. I grew up with a family of 11 as well, 6 sisters as well, Mario. I did not know that about you, right? And we were also an immigrant family as well, and came to the US in 1993, and was part of um, a lot of the tap into a lot of the social resources that Mario talked about as well. And so, in terms of answering this question, um, Katie graduated this program before I did. I haven't graduated yet, but we both belong to the Health Equity Leadership Awakened Fellowship that is put on by the Human Impact Partners. And their framework is really, this is why I appreciate Katie's question. Their framework really tried to integrate the head and the heart piece as we do equity work, right? That it's not just an intellectual thing that we're doing, the right thing to do, but also we have to bring ourselves and our lived experiences into this work, right? To integrate the two. And then I learned this methodology of not introducing yourself as like my name is, but actually start with I am, right? And so, you know, I'm an immigrant, I'm a Vietnamese American, and sometimes I struggle with that. And so I identify also as Vietnamese. Um, that's when I feel closest to my root and my ancestors, right? I'm a former welfare recipient, former CalOptima member, um, a former Section 8 housing recipient. I'm also a social worker, a community organizer, and sometimes in this space, saying that I'm a community organizer and community activist is really scary, right? I'm a Buddhist of the Zen tradition, right? Married to my beloved husband. I think I rehearsed this with him, so I have to say beloved husband. I'm uncle to 18 nephews and nieces. Those are the folks that I work for, right? The future and why I do this work. I'm an adoptive parent in waiting. Oh, and, I'm also my ancestors' wildest dreams. Everything that they would not want me to do, right? I'm doing. Right? Be scared of me doing, I'm doing. And so for me, like all of these experiences shape me, who I am, right? And what fuels the work that I do. Um, I think, Katie, to your point, like what shoulders do we stand on, right? I think behind Mario, you have Cesar Chavez in term as in your background, right? So I stand, and I think we all stand on the shoulders of civil rights leaders, right? Labor leaders, LGBTQ activists and leaders. For me personally, I stand on the shoulders of Viet queer activists that in 1980s fought for our rights, right? And um, one of my mentors just passed away, but he was the first same-sex marriage or ceremony in the U.S., right? He was on the news, right, in 1990, I think 1997, right, or 19 something, early 1990s. But I stand on his shoulders and all of the queer activists. Um, I also stand on the shoulders of my parents and my ancestors, right? Who lived through war after war, lived through colonizers after colonizers, And then for me, I also stand on the shoulders of young people, right? Young folks, social activists, community organizers that are really pushing, and we see this in the last 3 years, right? Really pushing systems and organization to pay attention to racial justice, right? To social justice issues and causes, um, and really force us to take action, put our money where our mouth is, and take action, and not just commitments, right? But take action on these issues. So yeah, those are the giants that I feel like I stand on, and I get to do this work and be in community with folks who are working every day, like Mario, Katie, and all of you all here for really a healthier, right, more resilient and equitable Orange County. And what a blessing is that? Like, such a blessing to be able to say that, right? It's such a privilege. And I think in answering that question and hearing Mario, right, we're not trying to perpetuate this model minority myth, right? We're also not trying to perpetuate this bootstrap mentality, right? As long as you work hard, right? I think we're trying to acknowledge that um, the resources that we need, right, to enable us to have like a fair shot, right? Um, and to have, yeah, as a fair shot and like really help us get to where we're getting and being able to do the work that we're doing. And so that's how I would answer your question, Katie.
That was really powerful. I didn't know I was going to be crying during this info series, so thanks, Hugh. I love learning more about your stories, and I really appreciate you acknowledging all of the different things you've overcome, but also how that drives you to do this work to make it easier for those who follow. I think, for me, as somebody who is not an immigrant, I am an only child. I do not fit in with you guys in any way other than my commitment and my excitement to be here with you all. I think for me, my journey to equity, it's always been kind of in me. I've always been really passionate about it as a child. But for me, it clicked with two things. Personally, or let me start with professionally. Professionally, as a background in public health, I work for the health department in LA County. I was hired as a policy analyst to look at housing as a social determinant of health. And in this country, you cannot unpack the connection between racist policies rooted in housing discrimination, like Mario said, and health outcomes. And so historically, where we have redlined communities, we have poorer health outcomes. And it's just like 100 years later, when you look at where we forced people to live, those are where we have poor health outcomes because we didn't make investments in the kinds of resources that people need to thrive. And so professionally, that was where it clicked for me. Like I was like, okay, racism and health or racial equity and health equity are one and the same. We can't talk about health equity without talking about racial equity. We can't talk about health without talking about health equity. So for me, just public health background is really where that health equity language clicked. And then personally, I would say my journey, it really solidified when I became a mom. So I remember in 2015 holding my newborn baby boy. Baltimore is on fire because Freddie Gray, another Black man, was murdered. And I just looked at my sweet baby boy, his chubby cheeks and his long little lashes, and felt this like deep, bone deep rage and pain that every Black baby boy's mother felt when she lost her son. And for me, that was my personal awakening for why I do this work. And I think that I see my children's future as being inextricably linked to the success of all children today. My children are only going to be as well off as kids in the poorest neighborhoods. And so I think that it's fundamentally important for our future to make sure that we really drive for equity. So that's kind of how my skin in the game shows up. And I love, Hugh, that you brought in the head and the heart framework, because we're whole people that come into this work with college degrees and trainings and standardized tests and certificates, but it's really hard to do health equity work without doing the self-reflection of why we're in it and how that keeps us going. So with that, when we talk about what keeps us going, over the last few years, we've seen so many issues related to health equity that have really been magnified for us, whether it was COVID-19 or the unrest following George Floyd's murder. And we've seen incredible inequities kind of magnified, as well as incredible community resilience and adaptation. So what stands out to you both as the most important lessons we've learned about health equity throughout the pandemic and the social movements in the last few years?
I think for me, what stands out, I think, as lessons, like I think across the country, there's just been an awakening, right, of realizing that the system doesn't work for many of us, right? And it definitely not working for the most vulnerable, the most impacted communities, right? So everything that were disparities and that were inequities prior to the pandemic only compounded, right? There was I think all of us had a rude awakening as to the reality of what's happening, right? And if any of us think that the system right now, the system itself, the big system, is working for any of us, take another look. It's not, right? It's not only just not working for people of color, right? It's not working for probably all of us, right? Except for Elon Musk or Jeff Bezos, whatnot, right? But so equity, when we work on equity, that is going to impact everybody, not just those that are in need or that are under resourced. That's going to help everybody, right? So I think that's one lesson. There's a rude awakening, and we're organizations are not just putting out declarations and commitments, which I think that was happening a lot. I think there are more and more organizations that is putting that is putting their money where their mouths are, right? And that are trying to do some hard work. And I would say that it's important for us to do this work, not just outwardly, like working with community and for community, but also do a lot of introspective work as individuals, right? That's why we bring the heart into this work. Like, what is our why, or what is our why not, right? And then also for organizations to do that introspective work as well as organizations. And so I think sometimes I see that the lesson that I'm seeing is that sometimes a lot of this equity work, it's just, oh, we need to do this in the community, right? Do this with community. And is seldom about that introspection personally and organizationally, right? What else can I say in terms of lesson? Oh, and what Mario kind of highlighted, what the power when we bring people and organizations together, and not just together, but together with alignment on a common goal or common mission, right? Oftentimes we come together, but we can't agree on a goal, right? So we go off and we do our own thing. We take our own different approaches, our own strategies, our own programs, our own services, right? And we don't have that common goal that we work towards for that collective impact rather than small organizational impact, right? So the power of coming together as organizations, as systems and organizations and community. I think that would be my second lesson. And then power, right? Katie, you talked about power. Mario, you talk about power. And for us, the big system, right? CalOptima and HCA, thinking about what power sharing looks like from a county agency, from a large system agency, what does it mean for us to share power with community, right? And what power do we need to give up, right? Um, and so that's sort of in the, I think, very beginning stages of conversation. And I think the other lesson in power is within community, right? Within community, in community spaces, what does power sharing look like as well? And how do we build power, right? Within community and also from large agencies with community. How do we build power with community? So I think those are some kind of three lessons that I'm kind of taking away from COVID-19 and everything that we've gone through in the last 3 years.
I think I agree with a lot of what Hugh said. I also think that the system change is not easy, and it's not fast either, and it's going to take a while. And I think what I hopeful of one is that we are seeing some of the commitment from the public healthcare agencies, from the county government. We are seeing that it's more intentional and not just a checklist like we have to do our DEI, organizational assessment, but actually really looking internally. I think that is happening. However, because it is so difficult, what I don't want to is that this becomes just a period in time that was highlighted because of the pandemic, and then it's too hard to keep doing it, and it is hard work, and so that after time, people start like, well, what's an easier way to do this? What's an easier solution? And there isn't really easy solutions with it. So um, I think it's that we all have to be committed for the long term of this, to one, to hold ourselves accountable, our agencies if we're in a leadership position, um, to continue to do the work and be reflective, but also to work with the those that are part of the system, and to work with them to change the system 2 years from now, 3 years from now, because that's the reality. And so I also think of we don't want to lose sight. There's some great initiatives that are happening. You guys mentioned CalAIM. That's a great opportunity for systems change for CBOs and healthcare agencies working together. Um, but it's very difficult to navigate it. It's very difficult to. So when we talk about power sharing, capacity building, um, if organizations have a tough time trying to navigate that system, we could get stunted at being able to actually have some of that system change. So that's my. We've come a long way, but I think it's also we have to be realistic that it took a lot of years for us to get to where we are now, and that we have to keep doing the work and keep a part of it. Go, Hugh.
No, I mean, I just want to add, maybe Katie, where you share the recognition and realization that us as a county, and I know CalOptima would probably agree with this as well, is we need to continue to work at building the trust, right, of the community with large systems like us, government systems like us, right? And so, that is building the trust with the CBOs, the community-based organizations, our partners and collaborators, and also, most importantly, also building the trust with the community. And that's a lesson that came to the forefront during the pandemic, right? So I think that's a recognition for us, and that's a commitment that we're making to continue to do that. Because ultimately, for CalOptima and for HCA, it also serve us, right, from a business standpoint, when we have an expanded network of provider, right, that we're able to tap into when we need the critical mass, or when we need to reach out to the most vulnerable communities, right? The highly impacted community within not just zip code, but census tract, right? Equity census tract. So like from a business standpoint, from a healthcare delivery standpoint, it's important for us to have that expanded network of providers to be able to do this work, right? So just wanted to add that. Sorry, Katie.
No, don't apologize. That was so important. So a couple things that you all have mentioned have piqued some things we've discussed in the past, and really, we've talked a lot about the zero sum paradigm or mentality and scarcity mentality, and how has that gotten in the way of advancing health equity, and what is the antidote to that?
Yeah,
Oh, go ahead. Yeah, Mario.
I know it definitely is. I think we have to acknowledge that it definitely exists. I remember early on in our vaccine equity work, I was called into a few meetings that I didn't realize until the meeting started that I was kind of being brought to the principal's office because of our vaccine equity work. Some others didn't want us to be a part of it, and realized that okay, that was because of people scarcity. People thinking, well, wait, does that mean that funding is going to go somewhere else? Um, and it was surprising to me a bit because I'm always thinking, well, what's the best for the community? I need to help my community get that access to the vaccine. That's all I'm trying to do. But I realized like, okay, that is something that I have to acknowledge and be aware of. I went into it naively at the beginning. Um, but at the end of the day, I decided like we had to keep pushing forward because I knew what our intent was, and our intent was to get those that are at risk of being hospitalized and dying to get vaccinated. And so the rest of it, we have to be able to work on getting past that with partners, and sometimes it's with new partners. Um, I think I think I'm good at hey, we can agree or disagree, but I'm good at being able to like let's move forward. I think I have a problem solving. Like I always want to find out how do we solve this and move forward. Um, but I think though also with it, some of the funding that has to do this work, sometimes it is set up to be a competitive nature. It's just the way it is. And so I think the funders have to look at how they fund some of the projects and say, is this equitable? Is it happening? And are we the way we're setting it up? Are we creating um, collaboratives or agencies that might start working against each other or feel some hostility towards each other? So I think those conversations are that we have those and say um, that we express that and see if we can be a part of changing that. It may not happen, but I think it's important to do those conversations, and um, and sometimes it's okay sometimes to move on in another direction with other partners or however it may be if you can't get past some of that scarcity. This is my pie. I don't believe in that. I mean, I've never worked that way. There's been the whole one of the things that the term is used a lot is that you need a seat at the table, and otherwise if you don't have a seat at the table, you may be on the menu. That phrase of but the both things could be true. You could have a seat at the table, you could still be on the menu, but I think it's important to like still push through. And I think for us, I feel like I'm in the next generation. I'm in the plus 50 category, so I do think it's important to also give that space. So sometimes it's good for me to move back away from the table and have our partners come on in there, and that they have energy and ideas and creativity that I would not have, and to give that space and be inviting and really want to have an impact that is. It's okay to say, "Hey, I'm not the best solution for that."
Yeah, thanks for that. I think there's a lot of promise in our youth. So
Yeah.
as we wrap up, oh, go ahead, Hugh. Were you gonna say
No,
something?
I kind of just want to make 2 points. One is that the scarcity mentality, the bootstrap mentality, what's my piece of the pie, the zero-sum game, right? Mentality. That's what the system has sort of perpetuated and have created, right? And so I want to acknowledge that we know that this mentality exists in communities and with CBOs. Um, and yet also recognize that it is perpetuated by the system, right? And what we would call, and I can be bold to say, white supremacy culture, right? And in ideologies. So to acknowledge that, and I think the second piece is that when we put people at the center, not just CalOptima members, not just HCA clients, not just Mario's community members in the center, but we have, you know, if we put the community at the center, the people at the center, um, then it will. I think it will be the anti or be the opposite of what the scarcity mentality would get us to believe, right? I say that because if I just only focus on HCA clients and nobody else, right? It's still not going to solve the issue that we're dealing with, right? So we got to put the community at the center and the individuals in the community at the center. Of course, we're going to have intervention. Of course, we're going to have programs and service that's tailored to our membership and whatnot. Yet at the center of this also is the community at large, right?
Yeah, thank you. Okay, so in our call to action, I have a rapid fire question. You have to be very succinct. What are your top 2 tangible items you would recommend for organizations to help move the needle on the social issues we've shared? I've had the privilege of looking at this question and thinking about it, so I'm going to take facilitator's privilege and going first.
Please do, and then we can end it. We don't
As-
have to hear from Mario and myself.
As someone who works within systems, I think that it is very helpful to have a equity tool force you to reflect on how the system is working or not working well for the people that you're trying to serve. So if you Google racial equity tool, health equity tool, there are a number of tools out there that are a great place to start. Ask the right questions, make sure you include the right people, look at the data, and think about who's impacted most and involve them in decision making. That is sharing power, as Hugh's been saying. And then the second thing is don't do it alone. You can't do it by yourself. Nobody can do equity alone. You have to build a team that is diverse, that is willing to be vulnerable and learn together and challenge each other. And those are my 2 tangible recommendations. So build your team and get a tool to do some self-reflection and learning together. What do you all think?
That's great. Great.
Hugh, would you have top 2 tangible?
How to tangible, join the Equity and OC initiative.
There we go. And how do people do that?
Just go on www.equityinoc.com, or you can email me at hnguyen@ochca.com.
Okay, we'll make sure to get that out to everybody who's joining us today. Mario?
What I would say is be part of the system. That doesn't mean that you're caving to the system. That doesn't mean that you're agreeing with the system, whether it's the work of HCA, CalOptima Health, or government. But you have to be a part of it. So you have to join and participate, whether it's on a task force, whether it's part of collaboratives, whether it's part of their meetings and asking questions, whether it's asking to meet with their leadership. You know, depending, you may get turned down a few times, but still be part of it. So your voice of your community is heard. That's one, and then also definitely collaborate. There's no way. That's the whole thing of what I always say about scarcity is there's no super agency or super org that can do all of this work. How many nonprofits exist in Orange County, and we still have a lot of issues that need to be addressed, and we're all working on, and we need every single one of them. And so we have to collaborate. We have to work together to do that.
Yeah, it's a journey, not a destination.
Yeah.
All right. Thank you all so much. We could go on for longer, but we may just have to grab dinner and keep the conversation going, right?
Hey, I like that.
All right. Well, I turn it back over to Tiffany to close us out. Thank you, Tiffany, for giving us the space to unpack some of these questions.
Thank you,
For Ho-
Katie.
Holly, sorry.
No worries. Thank you, Katie. So my name is Holly Mendez. I'm the Community Relations Specialist here with CalOptima Health. I do just want to give a special thank you to Hugh, Katie, and Mario for being here today to have such an open and candid discussion with all of us on who they are, the work they do, and sharing their collective efforts that they're doing here for our community. For all our participants, we hope that you leave today's presentation with a greater understanding about initiatives taking place to address health disparities and ways to join these efforts to support equity for a healthy Orange County. Next slide, please. So before we close, we are pleased to share that CalOptima Health is hosting a CalFresh Enrollment and Resource Fair in Huntington Beach. It is going to be this Saturday. So CalOptima Health is working in collaboration with the County of Orange Social Service Agency and the City of Huntington Beach to host an event to raise awareness about the CalFresh program. So the event will be Saturday, November 19th from 9 a.m. to 1 p.m. at Murdy Park in Huntington Beach. We will offer on-site CalFresh enrollment, food distribution, diaper distribution while supplies last, community resources, and activities for the whole family. Flyers will be dropped in the chat box. They're available in English, Spanish, and Vietnamese. And we look forward to seeing you at this upcoming CalOptima Health event. Next slide. And I just want to give a thank you to our providers and community stakeholders for your interest in today's info series. And on behalf of CalOptima Health, I want to thank you for your collaboration and supporting equity for a healthy Orange County. I hope you all have a great rest of your week. Thank you.
Thank you, everyone.
Bye,
Bye.
everybody.